Hi. So we're doing back of the shoulder. Last time we did what? Front of the shoulder. That was 44. This is 45. Back of the shoulder. So we're going to do the whole arm, right? Everything. Let's see if we don't have it before. Yeah. So here's protocol 45. And the muscles that we've got that we're going to be working with today, if you can take a look here, the most likely one to cause back of the shoulder pain is the posterior deltoid. Levator scapula is the second most likely. Scalene is the third. Supraspinatus the fourth. Teres major and minor the fifth. Subscapularis, the frozen shoulder muscle, is the sixth. Seventh is posterior serratus, posterior superior. Then the eighth most likely is latissimus dorsi. The ninth is the triceps. The 10th is trapezius, and the 11th is the iliocostalis. Can you imagine 11 muscles cause back of the shoulder pain? Oh my gosh, right? 11? Look at all these muscles today.
Wow, it's a lot of
This is a
tabs.
lot of muscles.
It's a well-used book.
Yeah, it is a well-used book, and that's a lot.
That's what your book should look like, everyone.
That's it.
Yeah.
Yeah, you're supposed to look like that. So it's so important that we have our arms and our hands working for us, and our shoulders. Front of the shoulder. Okay, good.
Yep.
Okay. So it's so wonderful to have our shoulders in good shape. And now we're going to also look at some underlying perpetuating factors today in shoulder pain. And one of them is sleeping in such a way that you make your shoulder dysfunctional. So that's a real important one. And also remember, unbend the arm. That was one of the ones from last time. For that was the biceps. You know?
Yeah.
So those are a few things. So we're going to take a look at some nerve compressions that we're going to be fixing today. And we're going to use a lot of tools. So let's take a look at all the tools we're going to use. We're going to use some tiger tails. We're going to use balls, different size balls, jack knobbers. We're going to use stretching straps. We're going to use tiger tails. And we're going to use some back knobbers.
Familiar friends.
They are
For anyone
familiar.
who
And we're going to look at
does self-care.
first metatarsal deficit and looking at some corrections for that. And also we're going to look at seated posture, standing posture is an underlying perpetuating factors in shoulder pain and dysfunction. That's right, that's right. Okay, so we're going to start with the first muscle. Let's take a look at each muscle as we're going along. First, we're going to look at the deltoid. Let's take a look at a picture of it here and see the deltoid muscle. So here's the deltoid muscle. And you can see it attaches here on the collarbone, on the acromion, and also on the spine of the scapula right here. And it causes back of the shoulder pain right here, especially the back part of the deltoid. So that's the most likely one. Now let's go to the second most likely one. We're going to look at the levator scapula. Take a look at this one. You can see this one causes pretty significant shoulder pain. And you know, levator hurts a lot, particularly when you turn to the same side. So you turn your head to the right side, if it was the right levator, because this particular pain right here. And you can see it attaches on the transverse processes of C1 through C4 and onto the superior angle of the scapula. And let's look at one more, and then we'll start to do some self-care. Cool. And here's our scalene muscles right here. And these are attaching here from C2 down all the way through to C7, and then attaching here onto the first and second rib. And these are significant because look at the kind of pain that it causes. So first of all, it causes front of the shoulder pain, right? But it also causes back of the shoulder pain. That's what we're looking at today. And between
a lot of intense pain
between the shoulder pain right here. So this is really significant. Top of the shoulder pain, between the shoulder, back of the arm, and all the way down and into the hand. Very much reminiscent of carpal tunnel syndrome. Now there's a little teeny scalene that's right here, attaches on C7 and onto the lung pleura and onto C1, the rib 1. And it can cause you to have pain in this pattern right here. But so you see how you get the pain pattern on the thumb side, and also you can get swelling right here. So, but there's one more really important thing. We're going to have a lot of, this is the test we're going to do for this one here. So here we're testing it. So this is a pass. This is a fail right here. See where the fingers don't bend all the way. Now we're going to look at the nerve compression. So this muscle, the scalenes, even though it's four really small muscles, can cause entrapment and edema in the hand and entrapment of subclavian nerve and lymph duct. It can cause compression of the long thoracic nerve between the posterior scalene and the medial scalene, causing numbness and wing scapula. It also could cause entrapment of the lower trunk of the brachial plexus, which that would be, so you could say the pain you feel is on this side, over here on the thumb side, but the numbness you feel on the ulnar side, on the little finger side. So it can cause you to have pain, even if you have compression of the brachial plexus here, the lower trunk, it can cause you to have pain in this side as well as numbness and everything on this side. So you can have a really bad trouble with the scalenes. So we're going to do some range of motion tests for just those three, and then we'll do our self-care for those three, and then we'll go on to the next three. Sounds good?
Sounds good.
Okay, so let's do all of us do a little range of motion test, so let's all of us stand up. We're going to do this for the first one. So here, if you take a look over here, Martha, if you come over here. So we're going to do this first range of motion test here, the cervical rotation. We're going to do cervical lateral flexion right here. So we're going to rotate and then flex to the side. Then we're going to come down and do the scalene finger flexion test right here. So we're going to do 1, 2, and 7.
1, 2, and 7.
Yeah,
Gotcha.
we're gonna do those. Yeah,
Cool.
so we'll do those. Okay, so let's go ahead. Let's each one of us do it. So let's go ahead and just feel. So let's go ear to our shoulder, and how close are we getting to our shoulder? Ear to our shoulder. You can see how close. Feel how close you're getting to your shoulder there. What do you think you can feel? How you doing? Okay, so that's one rotation. Let's go ahead and rotate and look right over our shoulder. You're trying to get our chin towards our acromion right here. Let's turn and let's see if we can get our chin. So just sort of feel how flexible it is right now. Good. And then next one we're going to do is our scalene finger flexion test. So that would be where we extend the metacarpal phalangeal joint, and then we're going to bend all the interphalangeal joints. So like that. So let's go ahead. We'll do it on the wall because that's a good way to do it. Okay. So we're going to go ahead and do that. So let's do it right here. Stop right here. So we're going to put our hand right on the wall. So let's all go ahead and put our hand on the wall. Let's get all our knuckles on the wall. Okay, so that we got to make sure, and then we're going to bend them. And you can see, if it was like this, then you would say, oh my gosh, she's got really bad carpal tunnel, or she's got really bad scalene compression, and so it could seem like it's carpal tunnel. So that's it. So how about if you had just had one finger sticking out like that? Then it wouldn't be scalene. It would be probably the finger extensor and flexor of the index finger here. But here, so we're looking. Can we do this? So go ahead. Let's check everyone.
We
So
had
you
a
wanna
good question that was asked last week as well, I believe, about if you have arthritis, what might you do?
Well,
instead of
arthritis,
this one?
even the arthritis foundation considers muscular dysfunction a kind of arthritis. So arthritis. But it could be all different kinds of arthritis. But even all X-ray technicians and radiologists know that even when you have arthritis, you may have significant myofascial dysfunction.
But what's a good test to do? Like if it's hard because of arthritis to do those things.
It may be due just to the scalenes.
Sure.
It's like,
Okay.
so in other
So
words,
could be the same problem.
It could be that you think it's arthritis, but actually it's dysfunction of the brachial plexus because of compression of the scalenes. So a lot of times,
So
what
just
seems
do
to
that
be
test anyway.
Right.
And if you have difficulty,
then that's
like follow the pathway.
correct.
Should do
So
the treatment.
right, exactly.
Okay, gotcha.
That's correct. Yeah. So here you can see that we're doing pretty good. So not too bad this week, right? Let's try the other hand. Okay, go ahead. Go ahead. So that was kind of painful there. So go ahead and put your fingers right against the knuckles. Right? Yeah, so you're passing pretty good on that one. Okay, let's see how you're doing. So you get your fingers, that's not too bad. You can also see, can you do your thumb too? Get your thumb back, all the way back.
Oh, back. Okay.
Good, pretty good. Let's see if you can bend it. Yeah. So it's close. Okay, so let's go ahead and let's check you out. Okay, so let's get your knuckles all the way. So if we get the knuckles all the way back, we have a little bit of brachial plexus compression. Okay, and then how you doing? Okay, so here, so not too bad. Yeah, so you're doing pretty good. But is that a little hard? You're working
it's
pretty
hard.
Yeah, he's working pretty hard, so it should be a little easier than that.
Yeah.
Easier. All right, so we're gonna treat a few of those things, okay? See if we can improve. So okay, one of the things that we want to look at too, and let's look at this for a second, is nerve compression by not only by the scalenes, but nerve compression by the nerve roots. So the little multifities and rotatories, all the way from C2, all the way down to T10. So we're going to do that first. We're going to take a look at that first. So we're going to look at all of those and see if we can see if we find any dysfunction. So first, we're going to do some skin rolling, and then we're going to treat it. So each one of us. So once you two partner up and do some skin rolling along your spine, and let the two of you come. Just stand right here. You can do some skin rolling. So let's have you come right here. Okay. So you could go ahead and work with her.
Okay.
Okay. So we're going to go ahead and do some skin rolling, see if you can lift the spine up. How's that feel? It's okay?
Mm-hmm.
Yeah. How's she doing? Do you find any hypersensitive spots?
Can't roll.
And we're going to go all the way
Or not.
down,
But it
all the way
feels,
down here.
stuck in here.
Right there. So that's around, what would that be, about T?
Does this feel better
6.
to you?
Mm-hmm.
Okay. Oh, you feel like you're wearing a wetsuit.
He doesn't roll at all.
No rolling along the spine.
No
We
rolling.
did notice that last time you were here.
A
Okay.
little bit tight in the hair.
There's a little bit.
Okay, so a little bit tight, the lower section, so you find it a
Yeah.
little tighter in this lower section. Okay, so let's see if we can make it a little better. Okay, let's check you. Okay, let's see if we can check her.
It's really tight, lower
Mm-hmm.
cervical.
Okay, so
It gets a little looser down here.
come this way.
Yeah, I got a few.
Okay, stay here, you can watch me.
Like thoracic.
Okay, so what we want to do
Yeah.
is we want to see if we can lift the skin up over the spine. You can see we can here at C2, C3, but now we get to C4, C5, C6, C7, a little too tight. T1, T2, so it's hard to roll these. You can't roll these, so all of these are a little too tight. Okay, so from here down, we'd like it to be a little looser. Okay, so that's good. We'll try that.
I'm a good candidate.
And how did you
I
guys
didn't
do?
think I was.
I got a few easier spots, but most are tight.
Oh man. Okay, so we've got some really tight spots here.
Looser
Yeah.
down this
Okay.
way.
Yeah, so oh my goodness. Okay, let's see what we can do about that. Significant there. Yeah,
Yes,
so
I know.
yeah, and so we all need this here.
Yes.
We're all working. We need
We
this
all
working.
need it.
We all need this. Okay, so we're all gonna work on this. So let's come on
So
in
here
here.
we go.
My goodness, you guys. Okay, so some of us will like this longer tool. So some of us can try the longer one.
That's my favorite.
Yeah, and some of us will like the shorter ones. Right?
I like the shorter one, actually.
Here we go. So shorter
Some
ones.
are classic back knobber, others are back knobber too.
Using tigers.
Yeah.
The
Oh.
big bang.
The shorter one or
Yes,
shorter
the
one?
big bend.
I never used this, so I'm not sure I know how to do it.
Oh, well, we've got to learn.
This is what we're doing right now.
Okay, so let's start.
Yeah.
Let's start here at
It
about
goes in good.
Yeah.
T10.
It's nice.
Fits
So
in
let's
between my
start,
spine.
so pretty low. Let's go ahead here and look around T10. And we're going to go ahead and put the tool behind us. We're going to find the spine, just come to the right of the spine. We're going to press in and we're going to stretch it this way. And then we're going to come back and contract it. And stretch it
Oh, this is
and
cool.
twist, twist, extend. Let's come up from there. Let's come up a little higher. So feel the spine, come just to the side of it. You're gonna
Nice back
push
knobber
on the
technique, Kirk.
tool. You're going to lean forward a little bit, come back, rotate. and
Someone's asking,
rotate.
is in the lamina groove?
Yes, the
Yes.
lamina groove.
Lamina groove.
That's right. That's right. You say tomato, I say tomato.
Yeah. Cool. So
That's it.
yes.
The lamina groove. So it's going to again turn, and extend. So let's come up a little higher on the right side. So you're going to find the spine, come just to the right of it, and we're going to put our arm right on there. We're going to stretch it forward. We're going to come back. We're going to rotate right and rotate left. So we're going to come up a little higher. We want that spine to be nice and flexible. You got to have that really nice flexible spine. So we're coming up a little higher. We're up around C7. Let's go ahead and rotate, extend, and flex. So let's come up a little higher. Now here we do about C6, C7. So we're right here, find the spine, come just to the outside of it and lamina groove. We're going to twist and extend. Let's come up a little higher. Press in. And twist, extend, flex. come up a little higher. So now we're getting around C3, C4. Extend and flex and turn and turn. Let's come up a little higher. C2. And we're good right at, so find the spine, come just lateral to it, just to the right. We're going to extend and flex, extend and flex, rotate, rotate. Good. And how's that feel so far? Okay, let's do it on the other side.
It's a very useful tool.
It is. Oh, Linda, by the way, tell us the story you told us earlier about sleeping and the shoulders. What was that? What you said?
I was
Divorce. What? Go
I
ahead.
was testing out Sharon's theory about how the spooning position
Oh,
is
yes.
really bad for, arm pain, and
Yeah.
I thought perhaps that this would raise the divorce rate. However, I tried it, and it really did make a difference. I'm not divorced.
Okay, so with 1 week tested, not divorced, doing great.
Yeah.
So
I'm
she
actually
put-
putting my arm
she
back.
put her
on the
arm
pillow,
back instead
as
of
she
put-
had suggested.
Right.
Yeah.
That's
Instead
right.
of going over,
Yes.
they keep coming on up.
So we're doing the other side.
We're
same
doing the left
thing.
side, so we started at
Oh,
10. We're coming up. So we're getting right in that lambda groove. And we're going to rotate, rotate, flex, and extend. And come on up from there. Rotate, rotate, flex, and extend. Come on up. And come on up. And let's come on up from there. So you're about C4. So I'm right on it, and I'm gonna rotate, rotate, extend, flex, come up to C3. Find the spine, come just lateral to it on the left side. And come up a little higher, up to C2. So find the spine, then you're gonna cut this, and then you're gonna just lateral, and then you're gonna go like this, like that, like that, and like that. Okay, so let's go ahead and let's put our tool down. Let's all of us really flex, extend, really rotate, keep your hips forward, rotate, rotate. Good. Okay, so let's. You can check each other and see if you improved a little bit, but just keep in mind that it probably is going to take a little bit. It's probably going to take a little bit more work for you.
He
Let me
doesn't
check you.
roll at all.
I don't think you're getting older, maybe.
Oh, nice
Checking.
and red. You did good.
Oh.
Good.
Helped a little bit.
Okay,
didn't
so
it?
let's
little
go
bit.
ahead. So we're going to do a little skin rolling. Let's have your head back.
Where's the need at the worst?
So it's lifting up a little here, a little bit tight there. Yeah.
Right here.
Yeah.
So why did
So-
she feel pain
Yeah,
in her
right.
shoulder when we
Also-
go right here?
Yes. What
Yeah.
would cause that?
A
here.
nerve compression?
Yes. That's what it
A little bit is better.
Yeah, yeah. Okay, so this would be a good area to
You're
treat,
starting to get
to
a
get rid of that pain. Yeah. So let's look at that nerve root that we're
So,
looking at
so
there.
C4.
So here, let's take a look.
It's like everything, but I mean, in the same way.
So let's take a look. We're working
You
right
can
along
lose her
there.
down here, though.
You see how that goes down into the arm right here.
But that's
Oh,
not
we're
bad.
C6s.
Right there. It goes right down into the arm right here. Yeah. So so that's one spot that we'll really want to make sure to continue to treat. Now, one way you can treat that
Rogue knobbers.
is you could go into the shower and have the hot water pouring on it, right?
Okay.
Then with the hot water pouring on it, you could treat that little area out there.
Okay.
And then that wouldn't be so painful. And you could treat it,
So
yeah.
is it between C4 and C6?
Yeah, C6, C5, C4, yeah, all of those. Yeah, yeah.
And I noticed that this muscle makes
Uh-huh.
this hurt too.
Yeah, that's the scalenes. Yeah, that makes it all hurt in there. So let's look at that one. So let's look at that one again. So this, we're going to treat the scalene next. So you see here, it's right here at the side of the neck. And it causes you to hurt in the front of the shoulder and in the back of the shoulder and between the shoulder blades. Really bad. Okay, really, really bad. So we're going to definitely take a look at that, okay? So we'll try some different strategies for treating that today. So why don't you put a little heat on that for a moment, and then we'll get going on the next little area. Okay, so next we're going to treat the scalenes. What do you think of that? And the trapezius, okay? And the sternocleidomastoid. So let's go.
My favorites, all three of them.
Oh, you like those?
Yeah.
He's my
Right at the
favorite.
top of my head.
Getting all
Okay.
excited now.
Okay. Okay, so you could leave the heat on while you're working with it.
Oh.
Yeah. So that'll just make it a little more.
Oh, are we back to the?
Yeah, we're gonna use our back knobbers. Yeah. Okay, so we're gonna treat the side of the neck. Okay. So let's take a look at the part of the neck we're gonna look at. So here's the trapezius here. Okay. And it comes about to there. Then we've got the sternocleidomastoid here. So we're only going to be treating right here, right on the side of the neck, right there. Right here and right there. So it's just right there, right here on the side of the neck. So can I show you? Okay, so not there. Nope,
Oop.
nope.
I lost it.
So this is the trapezius. We want to be in front of the trapezius right here. So we
Okay.
want to be right here.
Careful of that juggler.
Yeah, it's nowhere near it. Okay, so right there. So right on the side right here.
Most likely fine.
This is right there. So
So what's a good landmark?
So what you want to do,
Behind the
see,
ear?
okay, watch here. So you see it's below the ear, right? But you find the sternocleidomastoid, right? It's behind the sternocleidomastoid. You find the trapezius.
Which is a big, thick one.
So you find the trapezius. It's in front of the trapezius. So it's between the sternocleidomastoid. So it's like this, like right here and it attaches down here on the first and second ribs. Okay, right here.
Yeah, I feel
Okay.
that.
So it attaches, so you want to get down there to its attachment on the rib, and it's in front of the sternocleidomastoid, so right here, and behind the trapezius. So you're just going to go
Kinda just going in
straight.
between the two really prominent muscles.
That's
there.
correct.
Yeah.
That's right. Yeah.
What's
So
the
let me
best
show you.
position to flex, to put your neck in for them to stick out?
They don't necessarily stick out.
But to
You
expose
just-
it,
You just have to know where they are.
but that's a good position the way she
Yeah.
just was though,
Yeah.
right? Just
Yeah,
turning
so
the
just
neck to
turning
the
your
side.
neck.
So
Yeah.
so here you find your trapezius, okay, and you find your sternocleidomastoid. So you're right in between. So for you it'd be just just put it right. It's just be pressing right here, and then you're going to go down here.
Short
So right
side should
there.
be useful, but
Right there.
sometimes maybe
Now
not.
you could just use your finger, just the way you're doing right now, just pressing in with your finger, like that. So that's one way of doing it, okay? And then you're going to go down, all the way down here to your, and also you could try using the tool. So here you can hold the tool, and what's good about the tool is you can keep your arms down, and so when you have your arms up, it sort of makes it hurt, you know. So there you go. So you're going to just press, so you could go right here, but don't press too hard, okay? So you can press in with the tool.
Do you
like
want to breathe
this.
and swallow in this class?
Okay, good. Okay, let me see. Yeah, perfect. She's perfect.
Oh, I know this muscle
perfect.
very well.
Let's see. Let's see. Great.
That's my main muscle.
Okay, so here we go.
It seems too big to get at it.
Okay, so this one has a smaller knob, so you might like the.
Can I just do it with my
Look at the,
fingers?
yes, you can. You could just do it with your
Am I
fingers.
on it?
Now this one has a small. This is the bigger knob. This is the smaller knob.
Yeah, I
Okay.
kind of,
Yeah, you can do it.
I kind of,
Yeah,
I kind of want to memorize it with my fingers. If I know it with my fingers, then I can
Fingers, great.
apply a tool
Yeah.
later.
Everyone's got a different approach.
That's good. So let's start high. So we're gonna start high. You're gonna
We're
press
doing all right over here.
right in. You're gonna pull it across to the opposite side like that, and then you're gonna come down and you're gonna push it across to the opposite side. You're gonna come down and push it across, and then come down, and then you're gonna go right down, right onto the ribs. Like so, right onto the ribs, right there like that. And then you could stretch it a little bit and contract it. Now that's the middle scalene. Now we want to go to the anterior scalene. So that would be, so you see where my tool is? Now you're just gonna slightly change the direction, and then you're gonna just slightly go more forward. And then you're gonna be right there on the anterior, okay? And you're just gonna go slightly more forward right there. You're gonna be right on the anterior. The anterior one is the one that causes hand swelling. So this causes the back of your hand to swell. So this is the one that you want to get for edema of the hand. Anterior scalene. Now, if you look right where I'm pressing again, I'm going to go up to here, and now I'm going to
Does
just
it also
go.
attach? At
So
the,
they all attach onto the transverse processes,
Okay.
but the posterior scalene attaches onto the posterior tubercles, and the anterior one attaches to the anterior tubercle. So it's just almost all in the same place, but slightly posterior and slightly anterior. And then down here. Now this posterior one, it compresses the long thoracic nerve, which then also causes you to have wing scapula. So that's so we get quite a bit of nerve and vascular and the lymphatic compression from this. So this one causes everything. This is the most troublesome one. Yeah, the scalene.
Can it play a part in thoracic outlet syndrome?
It is thoracic outlet syndrome for the most part. Okay, so it's the main thing. What causes it is the muscles pull up on the first and second rib and press the whole lower brachial plexus between the rib and the collarbone, and that's what causes that. And also so let's just take a look at a picture of that one more time. So here you can see that this is the first rib, okay, and so what's happening is when the scalene gets tight, it pulls up on the first and second ribs, and then it presses the brachial plexus and also the veins and the lymphatic also compresses it, so that we have nerve compression on the little finger side and pain on the thumb side.
So decreased blood flow and decreased lymphatic circulation.
Which is causing swelling in the back of the head here. Yeah, so it's very significant. So we're having all kinds of entrapment here. So we're having entrapment of the lower trunk of the brachial plexus. You could call this thoracic outlet syndrome, and you have the edema caused by compression of the subclavian vein and lymphatic ducts there. So this is a pretty significant problem.
Is it possible to get swelling in here? Because I've had like chronic.
Sometimes you've had swelling there.
Swelling, right?
So whenever I have swelling, I have swelling here, I always think work above, below, on either side of it, and look around for what might be causing it. Yeah,
okay.
Yeah, it could be. Okay, so let's take a look at the other side. So you could use the back knobber tool, or another tool we could use is this tool here. So all of us tried this little tool. And then you could use this one here also that has a little padding on it. You guys have one? Yeah. Okay, so we're going to do the other side now. Okay, so you have the little one with the padding. Okay, let's go ahead and try that. So see how we like that. So here we're going to go, again, we're finding the sternocleidomastoid. Where the back finger is where the anterior scalene is, right there. So we're finding the sternocleidomastoid. Where the back finger is where the scalene is. So we're going to go ahead and press with that tool. So what do you think of that big tool there? The big cushiony tool? What do you think is that?
I mean, it definitely goes in, really.
Okay.
You can make it go in very hard.
Yeah, and it's not so painful.
It's a broader pressure,
So,
which is nice, yeah.
and then we're coming down
Yes,
and down.
nice breathing. Breathing,
Yeah.
breathing in slowly. Breathing out slowly is very helpful for this.
And we're going to press down towards the collarbone. And so now we're going to, so we did the anterior, now let's do the middle again. For the middle, we're going to just go find the sternocleidomastoid, go straight in, right to the side. And we're going to press right in with our tool. And then coming down, and then down, and down right onto the first rib. Then we're going to go back up there and we're going to treat the posterior scalene. And we're going to get it again right here. And down, and down. So what do you think of using the back knobber, and what do you think of using this tool?
They're both good.
Okay, they're both good. What do you think?
This is a little easier to
A little
maneuver.
easier for her. Yeah,
I
so
think
she
the
likes this one a
back
little better.
knobber's a little easier.
You like the back knobber?
I feel like I have more control with this or with my
Okay, you
hand.
like this one with your hand, and
Yeah.
how do you?
Back number all the way.
He goes all
It's easier.
he's looking for more
It's like-
pressure.
It's true though, it does take some time to get familiar with it. Like it's not natural right away, but like once you get used to it, you're like, oh, it's all about the back.
That's what I use.
That's true. The back knobber. Yeah. So
Good
anyway,
gift, you know.
Well, it's now nice.
It's only 362 days or 3 days or something, but great gift. Great gift.
That is a great gift. Okay, so after we did the muscle, then we're going to stretch it. So So we're gonna ear to our shoulder, and ear to our shoulder, ear to our shoulder, and ear. Now the scalene's the third most likely to cause pain in the back of the shoulder. Okay, and between the shoulder blades. So the third most likely.
What is the first?
The first is the deltoid. So let's do the deltoid. Okay, let's do the deltoid. So it's all of us doing the deltoid. So let's give you those tools back, and we're gonna do the deltoid. Okay, we can put them over here.
Tools.
Okay, so we get some nice
So
tools.
reviewing, we used the jack knobber, staple jack. You can also use an index knobber. Different hand tools that are very handy. And the back knobber. That's 2, which is collapsible. This is the original, which is Kirk's favorite.
The other one.
Oh, the original is the skinnier one.
The skinny one.
It's metal and wood, and it feels
Okay, so let's
different.
take it.
If we
This is
start
bigger,
saying "take
too.
me out to the ball game," we'll
So
know
this-
that
this
we've
is a little hard to
sunk.
soften.
I like that.
Okay, let's do that one. Okay, so we're gonna treat the deltoid. So let's go
Okay.
ahead and treat the deltoid.
So you have to
unplug
unplug
this way.
yourself.
So let's do a little range of motion test for the deltoid. Okay, so let's go ahead. A little range of motion test is we're going to take the arm out, and then we're going to take it in like this, and out, and back. Take it behind, and then up. Okay, how easy is that? A little bit hard? A little bit hard? Okay, so what do you think? How's it for you?
Behind is
A
harder.
little bit high. This side, how's that for you?
Easy.
Okay, and you?
Behind is the worst.
Okay, so let's see if we can improve that. Okay, so all of us, we're going to treat our deltoid. So let's go straight like this. We're going to go right on the side. We're going to do the middle deltoid first. And the deltoid attaches right here to the acromion in the middle and down to the humerus right there in the middle there. So let's go ahead and let's go up and down. Let's go across the fibers and let's look for some tense, tight spots. Let's see if you find any. You find one? You found one?
Oh, of course.
And come all the way down to the deltoid attachment onto the humerus. Up and down, side to side, little circles. Okay, now let's go to the posterior. So let's go behind. Now this part of the deltoid attaches to the spine of the scapula. So it attaches onto the back of the spine of the scapula. So let's go ahead and let's look around in there. I bet you we're going to find some painful spots. What do you think? You guys? Sure. So yeah, the back of it. Good. Okay, what do you think?
Doing good.
So let's go up and down.
Yeah.
So find the spine of the scapula and go just below it. Let's go side to side, up and down, little circles. Now let's go down a little bit more. Okay, let's come on down. Side to side, little circles.
Oh, circles will get you.
Oh, she's got a spare ball.
That's right.
Always have a spare ball.
In case your ball falls. Okay, I found this painful spot. So I'm gonna hold it, breathe, and relax. So we're gonna hold that, breathe, and relax.
One of your watchers is saying, Sharon, you always find her painful spot.
I did find one. Okay. Okay, now let's try with that arm. Let's take the deltoid back and up, and the deltoid
Testing
forward.
again.
And let's just see, does it feel a little better? If it doesn't, let's go back and do a little bit more on that one, okay? Okay, let's go ahead and let's do the other side. So let's do the middle deltoid and then the posterior.
Much
so
better, someone said.
Oh, someone said
Yeah.
much better. Good. Okay. So we're going to go right here, and we're going to go right where the deltoid attaches onto the acromion there. And then we're going to come down from there. We're going to go up and down and up and down, and let's go side to side. And let's look for some taut. I found a taut band, but it doesn't hurt.
See,
I'll
she
press on
finds
it.
them. She finds them on herself too. She's just not in as much pain because she does it every day.
Yeah, well, it's not as painful then. That's true. That's true. Okay,
You find them and you eliminate them instantaneously.
That's it. I give it a try anyway.
Yeah,
And if it doesn't work that day, I'll give it a try another day.
yeah.
Okay, so now we're on the back part of the deltoid. And again, we're going to go back here right onto the spine of the scapula. And let me show you where that is. Let me show you where the spine is. So here's the spine of the scapula right here. So if you can go over from there and then down to here. Okay, so from the spine here and then over to there in the back. Yeah, that's it.
Ouch, indeed.
We're finding an ouch spot. Good. The ouch spots. We got to find those ouch spots. So I want all musicians and everyone who uses their arms and everyone who uses computers to know.
Everyone in modern life.
Everyone in having modern life that you can be pain-free and full function. Okay, let's find a painful spot. Let's hold that spot. Let's find a nice painful spot. We're going to press those painful chemicals out of that spot. We're going to when we lift up, we're going to let in those nice nutrients and blood supply into the tissue. So lifting up and letting those nutrients in and letting some ATP in and blood supply into that muscle. So let's now again look around for another painful spot in the back of the deltoid and go ahead and give it a good compression. Let's hold it there and breathe and relax. And then let's go ahead and see if it's a little bit better than it was before. So let's go ahead, let's do the deltoid and see if it moves better. And see if we can get it up better. Okay, another test we're going to do is called the I like to call it the infraspinatus test, but it's the hand to the shoulder blade test. Okay, so let's. We're shaking our heads about this hand to the shoulder blade test. Okay, so let's go ahead. Let me show me your hand to the shoulder blade. Okay, so here's the way you measure. You find the superior scapula and you measure from the superior scapula to the middle finger, and that's 10 inches. So let's take a look on your right. Let's take a look.
Where am I supposed to be going?
So we're going to you're going as high as you can. Yeah. Okay, so then we're going to turn here. So you can see, here we go. So she's like 8 inches, okay. And let's take a look at Kirk. Okay. Oh boy. Okay, here we go. Okay, so Kirk, he's 21 inches there. Okay, so that's pretty stiff there. Yeah. Okay, so let's take a look at you. Okay, and so here we're gonna look at the here, and then we go. So that's
Leslie's asking. This is for deltoid.
No, this is
we're moving on now.
We're moving on, but it does test deltoid too. But we're looking at the infraspinatus. And also is the main one for infraspinatus, but also let's take a look at this test over here. So it's the hand to the shoulder blade test. So all of you come on back here. Let's take a look at this test. So we're going to take a look at the hand to the shoulder blade test. Here it is. So that's test 14. So here you can see. So we're measuring from the superior scapula to the finger, so she would be like minus 3 or 4 inches from the top of the scapula. And Kirk, he was having difficulty with number 13, the back rub one. So he was having trouble getting his hand back there. So we're doing those two tests, and that's the most likely it causes the one that causes the most trouble is infraspinatus, anterior deltoid, supraspinatus, subscapularis, supinator, pectoralis major, latissimus dorsi, and teres minor. So it tests a lot of the muscles, but the most likely one that causes is the infraspinatus. Okay, so we saw. So you're supposed to be able to actually come. This is like here is about low normal, but this would be ideal. Is if you get your hand all the way up to the superior spine of the scapula. Okay, so let's go ahead and let's treat that infraspinatus. Okay, and then also let's also treat latissimus dorsi. So we'll treat latissimus dorsi, and we'll treat pec major. Okay, and subscapularis. So we'll do a few. And we'll do supraspinatus, infraspinatus. We'll do pec major and latissimus dorsi. So we'll do all of those. Okay. Yes, we will. We'll do them all. We'll do them all. Okay. Okay. So let's go ahead. Let's use our balls again, and let's go ahead and treat the infraspinatus. And we'll get I got a nice ball in my pocket.
Of course you do. Back to the wall. Back to the wall for you.
So a lot of times, if you test, you can get one hand up pretty good, but then you can't get the other hand up as well. A lot of times that's the shoulder you sleep on. So that's the one I always try to keep after. I try to not to sleep on the same shoulder all the time, and the one that I always sleep on, I try to treat that one a little bit more.
Look at this is the one that I stopped sleeping on.
See, you stop sleeping on it. It's good.
Is it
Now
better?
look at that. That's only 2.5 inches. Yeah,
Compared to this one.
yeah. So this one here, what was it? Was more like 8
Or something.
Yeah, no, it's a little better now. I'm gonna just measure
Maybe
it
I have
now.
one arm shorter than you.
I'll just measure it. Okay, so here's the spine. Okay, it's better. It's 5 inches. It was 8 inches a minute.
Oh, it was
couple
8.
minutes ago.
Oh, okay.
Yeah.
Okay, 8.
Yeah, it's getting better now. Okay, so we're gonna do the spine of the scapula. So here is we're gonna treat this part here, then we're gonna treat this part over here. So we're gonna treat these 2 sections, and then we're also gonna treat the anterior deltoid. Okay, so we're gonna treat these and the anterior deltoid there, and then we're gonna go in and treat the subscapularis. Okay, but one more test before we do that. Okay, and also the another muscle. Okay, so here we go.
This was the good one. I should be working on this one.
Okay, so we're gonna go right here. We're gonna go on the spine, the scapula. So we're going on your shoulder blade.
Ooh.
You get your hair a little bit to the side.
Way of my things. Okay, here we go.
How are you doing over here?
Oh, I've got it.
This is not pleasurable.
No.
No.
Well,
Someone's
no.
asking, they have
No.
deep
No.
shoulder joint pain, Mom.
Not at all.
Okay, this could be causing it. This is
The faces of displeasure.
it can cause really bad shoulder pain. Yes, it's significant shoulder pain.
So basically, many of the muscles and
All of these muscles cause shoulder pain. Everything
basically everything in Protocol 45
causes shoulder pain.
might
Yeah.
help you with your shoulder joint pain.
Yeah, yes, that's exactly correct. Yes. So here, okay, how do you know if this muscle is causing your shoulder pain? Okay, you get right on the muscle and you look for a painful spot. When you press on it, if you feel that deep shoulder pain, you know that this is the one causing your deep shoulder pain. Okay, so you're going to look all through these muscles and look for dysfunction and pain in them. And when you find the one that's causing it, you'll recognize it. You'll recognize the pain.
Trust us. Give it a try.
Okay, another way of getting your shoulder up is your hand up is to get your hand behind and start stretching it while you're doing the activity. So you get right on the infraspinatus and the supraspinatus, and then you treat it right with the arm stretch. Now I'm going to get now above the spine of the scapula, so we're going to do the limbo, and we're going to get above the spine, and we're going to look for taut bands up there like that. Now let's look at some in our teres minor. So let's all of us look at like right on the shoulder joint right here on our teres minor, right here. Let's all look at our teres minor right here. And then we're going to look at our teres major right here.
Yeah, those are tough.
Right there. Our teres major.
I think everyone in this room is having trouble with that.
Okay, let's turn over onto the other side. And so again, we're going to look at the spine of the scapula. So let's everyone look here. So here's the spine of the scapula right here. You can feel it. So we're going to work below the spine and above the spine. And then we're going to turn sideways here. Then we're going to look at the teres minor right here. And then we're going to look at the teres major right there. Okay? So those are the things we're going to be looking at next. So let's go to your other arm, the one you didn't do before. Yeah. So now we're going to go. Whoa!
Oh no! Now you have to actually pick up one of them. Run through.
No, I got another
Oh,
one.
she does.
This is a good one. Okay, so here.
What's that one?
And are these
This is
the
a good-
notorious frozen shoulder
Wait, no,
muscles?
we didn't do the frozen shoulder muscle yet.
Oh,
Okay.
We'll get
we
there.
We're gonna. I think we'll do that one next. Okay, we're
Okay.
gonna do the frozen
But these
shoulder
are
muscle.
related, aren't they?
Well, yes, they're all related. Yes, they're-
We could say that about anything.
Stay tuned.
Everything's related.
Okay, so we're gonna go all over that shoulder blade. We're looking for any painful spots. Find a nice painful spot, and you're gonna press on it. Breathe and relax.
Oh, I found a cavern of rock candy embedded in my shoulder. This must have been from childhood.
Okay, now we're gonna take a look at the supraspinatus. So we're gonna go above the spine of the scapula. For you to do that, you have to do the Watusi here. See, you have to get the limbo. I meant.
Did you do the cherries?
Don't do the Watisi at all costs. Limbo.
So look for a painful spot and press right on it. Get right on that painful spot.
Where are we at now?
Doing the limbo.
Where are we
Okay.
doing?
That we can do.
I think we're having the release of endorphins, which is resulting in a little hysteria.
All right, then we can do the boogaloo.
What you doing now?
Okay, we're doing the teres minor.
Okay.
Okay, so we're right on that teres minor. We're gonna right on that baby.
Right on that, baby. Yeah.
We're getting right on that baby because it's
Yeah.
back of the shoulder pain. Yep. Then we're gonna come on down lower, right here, right down lower, right here, and we're gonna get right there. And we're gonna get right in teres major, right there, teres major. Look around for some painful spots. Get right on it.
Yeah, I think it's easier if you bend your arm.
You like the bending with a little
Yeah.
bent there? Get on that teres major. I'm on it right there.
Kurt's worn out.
I'm on that
some tough
teres
spots.
Found some
major.
tough spots. Taking a breather.
Yep.
Yeah.
Ooh.
Okay.
There's nothing minor
Now,
or major.
now
about
we're gonna
these.
look at latissimus dorsi. Okay, so I'm gonna get you stay here. I'm gonna bring you a tool.
Stay in the hall.
We're having a ball.
These are fit balls.
These are fit balls.
5 and 7 inch fit balls. Yes.
Yes, they are.
Nice for a little wider compression.
Okay, so now we're gonna take a look at the latissimus dorsi. So, so this one comes here, starts way up here, and then comes all the way down, attaches here on your pelvis and your sacrum. It comes all the way up here, and then attaches all the way over here onto your humerus. Okay, so a good way of treating that is we can put it on the stretch like this, and we can reach it just like this, but right above our waist here, and we can stretch it at the same time and treat it and look for some painful spots right through there. And you find something painful, go and press on it. So do you like these balls, or are they too soft?
A little soft, maybe, but they
Okay.
do work. I mean, they grip well.
Yeah, grip well. You can try that one there instead and see if you like that one better. And then keep coming up and come all the way up to its attachment onto the humerus. Now the nerve innervation for this one is amazing. It's C6, C7, C8, so in there. So the nerve innervation is way up here. So
And that was one of her
yeah,
key
right.
points.
Remember? Yeah, that was yeah.
C6.
So your nerve compression is way up here, but the muscle is way down here. Okay, so let's go ahead and let's do it on this side. So some of the fibers you get right on the side here like this. Comes all the way to the spine. Then we're going to come a little higher. Looking for some taut bands, and you can feel the taut bands better if you put it on a really good stretch. Then you can feel, oh, that's where it's tight. Oh, that's where it's painful. So you're looking for the tight spots, the hard spots, and the painful spots.
Would you say twerking is a good method?
Twerking? Well, I wouldn't use that expression exactly, but stretching.
You know, whatever you want to call it.
Yeah, stretching. Stretching it is
Well, you
really
were going
good.
up and down like that.
Twist
why.
and shout.
Yeah, let's call it the twist.
We know
and
the
shout.
older dances.
Yes.
Jitterbug.
Yeah, that's like that.
Twist, the twist. The twist is good. Let's come all the way up. Okay, so after we did these, let's see if we did a little better with our range of motion test. So now,
Okay.
let's see, can we go up higher than we did before? Let's see what we can. Yes, we can. Look at that.
That was a
That's
good one.
nice. Okay, let's see. So, how's it feel? Can you go up a little higher? Yes, Kirk, that's very good. Let's see
All
the other
right.
side.
I think it's a little higher.
Yeah, looks better. Yeah. Okay, so that's what you're looking for. Is you're seeing, can I get it up higher and higher? So you're trying, can I get it up all the way to the superior? But this is still, this is pretty good. This is better, and this is full function. Get you all the way up there. Okay, and then so let's do a few little range of motion exercises. So let's put the balls down. Yeah, you can leave those there, yeah. Okay, so let's do some range of motion exercises. So one really good for the teres major and teres minor is rotating like this. So let's do one at a time. Let's rotate in, rotate out. Rotate in, rotate out. Let's do the
Leslie
other
had
hand.
4-inch improvement.
That's wonderful.
That's
I
great.
could feel, I felt like I got about 2 inches better.
Yeah.
I really did. Yeah, I thought I improved quite a bit, so I was really glad. Okay, so let's go ahead and let's do the latissimus dorsi. We'll come like this. So let's crunch it. Let's stretch it. Let's crunch it. Let's take it behind our ear. Crunch it. Over the ear. Crunch it. In front of the ear. Other side. Let's go ahead. Shorten it. Take it behind your ear. Shorten it. In front of your ear. Right over your ear. Okay, so that's for our latissimus dorsi. How about for our infraspinatus? Let's do for our infra. We're going to come like this. Infra, infra. So we take these up like this. Then we're going to go like this. Infra, infra, across. Then we're going
He's
to go like
saying
this.
infra every time. Infra.
Then we come like this, or all the way around. All the way around. All the way around. So that's for our infra. That's also for lats. So that's for your supra. Okay, so they're looking good. And then the one we did for the scalenes was ear to our shoulder, ear to our shoulder, ear to our shoulder. And we want to do a lot of these. We want to get this in throughout the day. Really get our ear towards our shoulder all the time. And
Good computer breaks, right? Or
you could do these during little computer breaks.
mousing or
Mousing,
iPadding
breaking,
or phone breaks.
Phone breaks. You could
Off
have
the
little
phone.
You could have little off the phone breaks. Okay. Okay. So the next one we're gonna do subscapularis. Okay. So what's the range of motion test for this one? Okay. You go like this, like a right angle like this, and then you're gonna go like this. Okay. So what you want to be able to do is have a right angle like this, and then a right angle like this. Okay. Let's check you. Come over here. Okay, so let's see. Good. Okay, so but you want to have a right angle plus. Okay, so it's a little stiff on the plus, but it's very good. You know, very good, but not perfect. Then, oh man, it's just almost perfect.
Check the other one, see if I have a matching set.
Okay, so you want to have a right angle plus. Oh, this one's better than the right one. Yeah, and then you're going to come in like this. Oh, you're almost
right-handed?
perfect. So
I'm
this one-
left-handed.
Left-handed. Okay.
Listen, this right one just could be a hair better. Okay, so let's see you. Okay, come over here. Let her take your place. Okay. Okay, so let's see. So here's your subscapularis. Pass. Almost passed. Okay, so that external rotation and the internal rotation, pretty good. So
And you're
this
just
one,
this
just
gently-
a hair, just a
Well
little
done.
bit on the internal.
When you're doing that sort of test, you're just gently testing
Okay,
without
so-
pushing.
Correct. So what you're doing is you're just checking you put it and then just give it a little bit of it's like one finger,
Gentle
like
give,
one.
yeah.
So you're really not giving very much pressure.
Yeah.
How's it doing?
Okay, so you're excellent. You're so excellent.
Yeah,
So
this
so
one
this
has
is the
more
frozen
trouble.
shoulder muscle, you guys. This frozen
Getting
shoulder.
to it. Oh
Yeah.
my God.
Okay, so-
Kirk is ready.
Oh my gosh, he's got that one down there. Okay. So
Very
here,
excited.
pretty good, pretty good. A little bit dysfunctional in the internal. Okay, not bad. Man, whoa, everybody's
Finally,
so
I
good. Okay, let's take a look over here. So come over here. All right, so we're gonna take a look. Good, so I feel a little bit of something there at the end. Oh, there's a little dysfunction there, yeah.
Yeah.
So here, see, I'm not gonna push it any harder than that, you see? So you don't push it, see? So this is good for people to see how much they should push, okay? Okay, so let's look at the other side. So she passes the external but fails the internal. Yeah, so that's a fail on the external. So we're just light, really light. Yeah, I would say very, no, that's it. Okay, okay, so.
Can't really move that arm.
Yeah, so but that's, it could improve so much. It could get better. Oh, it could only take a few weeks and it could be a lot better.
Well, this
Yeah.
one hurts though. This one doesn't hurt, so I neglect it.
Oh.
And I'm right-handed, so I need this arm more.
Well, it's good to have both. But
Well, it is, but I gave up on that a while ago.
Okay, so we're gonna treat it. Let's all of us get one of these big black balls, and we're gonna treat it using this. Okay.
The larger ball?
No, the smaller one.
These ones.
Okay, thank you. Okay, so we're gonna get in here. And we're gonna treat the subscapularis. Now this muscle here causes pain in the back of the shoulder. Okay, but it's in the underarm, the muscle. Okay, but it causes pain
This
in
is
the
a big
back of the
frozen shoulder
shoulder.
contributor.
Yeah, remember the latissimus dorsi is here, but it causes pain in the back of the shoulder and the front of the shoulder. Okay, so that's a lot of the
subscapularis.
So now we're doing the subscapularis. So here we're going to put the ball right into the subscapularis here. That's one way of doing it. Another way is you could just put the ball under your arm like this. So go try that. So you could walk around like this, around the house. This could be your treatment.
With your toe gems on and your balls under your.
So this is a way of treating it.
Avoid housework.
Okay, let's do the other one. So that we get in here, and then we'll look at some other ways. But this is a beginning. So this gets rid of frozen shoulder. This makes the frozen shoulder muscle much more functional. And then here, another way of treating it is just getting underneath here like this, and come in here. Oh, it looks like it's time for the break.
Already?
Already? Oh my. Okay. All right. So
Is it a good time to break?
Well, just 1 second. We'll do the range of motion exercise
Sure.
for the subscapularis. Okay. So here we go. So the range of motion exercise for the subscapularis is we do the Egyptian. That's the range of motion exercise. That's one. Okay. Okay. And then also just come this
What if
way.
you're Egyptian? What do you do? Yourself? We'll work on that. Apologies.
So that's the
Okay.
subscapularis. Let's do then the other side. So here we go. And we're going to go like this. So you take it through its range of motion. Also, you could come like this, come like that. So little variations on it like this will be good for your subscapularis. All right, we'll take a little break, 10 minutes. The shoulder pain, super. Okay, so the next one we're gonna take a look here. Let's take a look right here. Take a look at the referred pain from trapezius right here. Can you see it?
Mm-hmm.
Okay, great. So here we're gonna look at this part of the trapezius. See how it causes pain up here in the shoulder, and then you've got some parts of the trapezius cause it to have pain in the shoulder, and also right out here. This all causes pain in the shoulder. So this is our trapezius. Then another one, we're going to take a look at the levator scapula. Okay, so here it is. So here's its referred pain pattern. So here's the levator scapula. So it's attaching here onto our C1 through 4, and then here onto the scapula. So we're going to look at the pain pattern it causes here in the shoulder. So this is our levator. And then we're also going to take a look at our triceps. So this is the triceps. We're going to take a look at that. That's the 9th most likely to cause pain in the shoulder. So let's take a look at it. So here's the triceps. See how it causes back of the shoulder pain right there. So that's our triceps. And then so the last one we're going to take a look at is we did the muscle, and it causes. Let's look at a nice picture of it here. So here's our iliocostalis, and it causes pain in the shoulder right there. So those are the ones we're going to look at next. Okay, so let's take a look at, let's get a couple of tools and we'll go ahead and treat those. So we're going to look at our, so here we did the, we did the scalenes already. We did the deltoid. Now we're going to do the trapezius levator. Oh, I forgot to say, we're going to do the posterior superior serratus, which is underneath the trapezius. We're going to do the triceps. We already did the supraspinatus, the subscapularis, and the latissimus dorsi. So we're going to take a look at them next. And we're going to give them a little stretch. So let's take out this nice big tool again, and we're going to treat
Our back knobber.
our back knobber tool, and we're going to treat the.
He wants this one.
We're going to treat the levator scapula. So let's go ahead and feel the side of the neck right here. We're going to get right on where it attaches onto the transverse processes right there. We're going to kind of come down, and going to come all the way down to the top part of our shoulder blade, the superior angle of our shoulder blade. So, but you know, you're supposed to be able to completely contract it and completely stretch it. Completely contract it, completely stretch it. If you can't,
Myopain.com.
yes. So here we want to, it lifts the shoulder, okay, so it lifts the shoulder and it brings the neck towards the shoulder. So you want to be able to move it without pain or dysfunction. And of course, if you can pass the ear to the shoulder blade test, that would be a good test for it. And the head rotation test would be a good test for it. Okay, now we're going to treat the whole trapezius. Remember that lower trapezius here actually causes upper trapezius back of the shoulder pain. So let's get down here low in the bottom part of the trapezius.
You have someone asking if that causes rotator cuff pain.
It does. All of these ones we're treating today cause rotator cuff pain.
Okay.
So this is
So all of protocol 45
and 44.
and 44.
Yeah, cause rotator cuff. So we're coming up. Let's give that trapezius a good stretch. While we're stretching it, we're going to be pressing on it, looking for some taut bands. So we're going to go ahead and look around all over in trapezius, and then let's look at the top part of trapezius up here. And we're going to get right over here by the acromion, and we're going to pull the trapezius, stretch it to the left and to the right. Get right there, right on the acromion, right on the edge of the shoulder blade, right there. And we're going to move the neck while we're doing it. Okay, let's go ahead to the other side. So let's go ahead, let's feel those lower fibers. Let's go ahead and feel those lower fibers of the trapezius right here. And let's stretch it while we're pressing on it. We're going to press on it while we're stretching it. And we're going to come up a little higher, looking for taut bands and painful spots. Look for those hard spots and those painful spots.
You'll
Spots or
feel it
painful
with
spots. We're looking for
Yeah.
hard spots and painful spots.
Yeah.
So hard
Right.
spots.
May
and
not always be painful, but it might be
hard.
hard.
So we don't want hard spots and we don't want painful spots.
Yeah.
So we're going to get right here at the edge, right by the acromion. We're going to look for painful spots right here. Look for some hard painful spots right there, because this can cause pretty bad back of the shoulder pain.
Sharon's demonstrating some expert back knobber technique.
Thank you.
Yeah. Kind of pushing it down. You sort of end up pressing it in ways you wouldn't necessarily realize.
Yes.
You end up not having to use that much
And then
effort.
the top part here, you want to really shorten it and really lengthen it. Get it to another spot, really shorten it and lengthen it. And shorten it and lengthen it. Great. So that's our trapezius. So usually when I'm working with our patients, I'll be wow.
What just happened? Oh my god.
Okay, so we'll usually color him in like that as we're going along, so we know what we're working on. So we did those. Now we're going to go here and treat the posterior superior serratus. Okay, right there. Now this one causes so much pain. It's the most incredible thing. The posterior superior serratus. We're going to take a look at it right here. So here it is. And where is the pain pattern? It's here somewhere. Here it is.
Truly
So-
in there, yeah.
So look at, it's underneath the shoulder blade there, but it causes back of the shoulder pain elbow pain and wrist pain. Is that incredible? It's the most incredible muscle. Okay, so to get that one, we want to get the arm, so we're going to get right here. So it's between the shoulder blades right here. So, but you're going to start here at like C6. So let's find C7 right there. So that'd be, so it starts here at C6, and then it goes over here to the scapula. And to get at it, you have to move the scapula forward. So you have to. Okay, so we have to protract the scapula. So you have to take the shoulder blade across to the opposite side like that.
Gotta expose them.
Yeah, that gets your trigger point. So the way I like to do that the best is to actually either use a jackknobber like this or a ball and do it on the wall.
On the wall, yeah.
So let's go ahead
Our
and
favorite
follow
tool today, the wall.
the wall. That's it.
That one hurts, yes.
That's it. So one way of doing it is you get your tool right there, and you're going to put the tool, maybe look behind me on the side there, yeah. So you're going to get it right there. So this is where the major trigger point is underneath where the shoulder blade
Ooh, look at
used to
that.
be.
Look at that.
Like that. So really right on it, like that. And so then you can go ahead and move it around. So you got to get it underneath the scapula. Yeah, get it underneath like that.
It does hurt so good, yes.
It doesn't hurt today, but it has hurt on other days.
Everyone's responding with commentary.
They are. Huh?
Yeah,
Okay,
yeah.
so here,
It's hurting.
so a way to do it with your ball is here you go. You come like this. You go to C6, C7. Then you rotate. You come this way, and then you come underneath the
Then you expose it.
Then you expose it. Go underneath.
Nice.
Then you go a little bit lower, and then you come underneath, like that. And then you move your ball a little lower.
Leslie asks, pushing under the medial edge of scalp?
Scapula. Yeah. Yeah.
Scapula?
Yeah.
That is yes?
Yes.
Okay.
Medial, underneath the medial edge of the scapula. So you get it way over like this, and you get underneath it. That's where your trigger point is. That's where you look for it. Painful. It can be very painful. Again, it goes all the way down the arm. Yeah. And it causes really incredible. One time, I had such elbow pain that it would be like I could just go like this. It was so painful. Just like the, oh my gosh, it's painful. And then I went up there and I treated the posterior superior serratus like this, and then I went back here and felt it and went like, oh my gosh, I can't even make it hurt. Like that.
So punching it.
Yeah, you couldn't even make it hurt after that. So it's
Elbow
like,
of steel.
so
after that,
so it's
yeah.
one of the things that causes really bad tip of the elbow pain, and also down.
One that isn't in yellow.
No, we didn't do the triceps yet. Okay.
Triceps, oh
Okay,
my.
so let's all of us do the triceps test. Okay, so let's all of us do the triceps test. So you're gonna go put your hand on your shoulder. Okay, let me see you do it. Okay, but not the same shoulder, same side. Okay, and then you're gonna get your arm behind your ear. So here.
Looks pretty good. Looks pretty
That's
good.
pretty good. That's pretty good. Let's see. Okay, so here.
A
you'd
paragon.
like to get her elbow way further back. Yeah. Okay, so let's take a look here. So we put our hand here, and we're trying to get the arm behind her ear. That's pretty good. So she's got it not
Pretty
bad there.
good. Pretty good, ladies.
And here we're not quite. So we're kind of at an angle like this. So we want to get
worse.
and this side too. We'd like to get it behind. Oh, that's not so bad. So you're getting it behind your elbow, you're a little bit there. So, okay, so we're going to treat our triceps, you guys. Okay, so one way to do it is the way you just did it. So we can treat the triceps by taking our back knobber tool and getting behind here and get right at that triceps. So we can get right behind us on the triceps. And I'll get a little picture of our triceps.
A little picture of her triceps.
Oh, we lost it. Page
No.
669. I lost my triceps. Here it is.
Don't lose your triceps, everyone. Keep hold of your triceps.
Don't lose it. Okay, so here, so the parts that are kind of like close to the body here causes the shoulder pain there. So we want to get like really close to the thorax. To the
Okay.
right
Using
there.
our back knobber.
Using our back knobber would be
Favorite back knobber.
one way of doing it. Okay, another way is we can do it on the wall. Again, We'll do the wall. Okay.
To the wall
To the wall
with your balls.
with your balls. Okay, so here, get right on our triceps. And we're gonna go up and down, side to side, and look for some painful spots on the triceps.
Mm. And you're doing this just with a relaxed tricep? Like you're not particularly
Stretching it.
stretching.
We'll try stretch one in a second.
So
Okay.
just a
And then here, let's do it on the stretch. So let's
Average tricep.
let's see if we can get it to pass our range of motion test. So we put our hand on our shoulder, and then we're going to go ahead and look for some painful spots. Like, okay, one reason we want to treat it on stretch is we could now,
Oh
I-
my goodness.
some taut bands stuck out when I put it on the stretch, and now I'm pressing on them.
you found some.
I found some taut bands. Yeah, I did.
You look so surprised.
I didn't expect to see some there.
Oh, I
So
feel
right
like
there.
I'm getting an injection with a needle.
Well, see, she's really getting them there. Yeah. So here we're
Yeah.
right on those triceps.
It's a killer.
So do it right while we're stretching it. It can be really good. Remember, this causes back of the shoulder pain.
Mm.
Back of the shoulder pain.
Mm.
Come down a little
We're
more
dropping
here.
balls. Okay.
And where it attaches right there. So get to its attachment. Right on the scapula there.
Oh my goodness.
So you found a painful spot, you guys?
Oh yeah. How can I have so
Right
much
there.
range of motion and
Yeah.
it'll be so tender?
How you doing?
It's slippery, so I have to hold
Slip it.
on to it.
Yeah, it's so tricky.
Yeah.
It's like, how can I have such range of motion, but this is like so painful?
Mm.
Yeah, well, it shouldn't be. So you need to you got to keep treating it until it's not painful anymore.
Okay.
Okay, here we're gonna do it in neutral first. We're gonna put the ball right on the.
So would you
ball.
recommend putting your tennis ball or whatever ball of choice into a little knee sock to assist with it?
okay.
or-
One thing is I like this ball better
Stickier balls.
because I like stickier balls because they don't fall down. They stick on the wall.
Used to
If
be
you
the
put
knee
them in the
sock, though.
stocking, they tend to slip.
Oh, it's
But
too
I do
slippy.
I like you know they've got their good points. You know.
There's ways to keep the balls in place.
Yeah, it can work. Yeah. So here we're going to the back of the triceps.
Got a
We're going
whammo
back
ball.
of the yeah, whammo.
Is that what
Whammo.
it's called?
Yep, it's called whammo. Looking for some taut bands and some painful spots. Push those painful chemicals out of there. Let's also do it on the stretch. So let's put it your hand. Let's do the little test. Put our hand on our shoulder. And let's go ahead and let's look for some painful spots. And then see if you can pass that range of motion test. Get right on those painful spots. Tight spots, painful spots. Okay, and we're going to do a little range of motion exercise with that. We're going to put our hand on our shoulder, lift our back, and come like this, contracted. Stretch it, contracted, stretch it. Other one. Stretch, contract, stretch, and contract. And let's rotate them in, and let's rotate them out. One in, one out. Other one in, one out. Good. All right. You guys, we did it. Okay, trapezius, up, down, forward, and back, and up, and down, and forward, and back. Good. All right, let's come on in. Okay, so we did just about all of these, but the iliocostalis we didn't do yet. So let's take a look at that one more time. We'll take a look at the iliocostalis. Here it is. Here's the pain it causes into the back of the shoulder, and then here's the muscle right here. So right along the spine, right here. Now the range of motion test for this one is touching our toes. Okay. Okay. So this is the range of motion. So let's see how good we do. So touching our toes. Let's see how we do. Let's go ahead and touch our toes. Let's see how we do. Okay, we got a few inches on you. Okay. touching. She's touching pretty good. You're touching pretty good. Okay. All right.
Once I
So
get started, then I can get
then you
lower.
can do it. Great.
Yeah.
Great. Okay. So let's go ahead and let's use our ball, and let's go ahead and let's treat that iliocostalis.
Back to the wall.
So it starts here in the ilium, right here, and so when we're going like this, we're going to be stretching it. So we're going to come like here. The trigger points that cause the shoulder pain are about right here. So let's go side to side and see if we can find the iliocostalis. It should sort of kind of feel like a ropey kind of thing right there, about there.
And about how far away from the spine is it?
So let's go about, let's look on you. So here's our spine, here's our ilium. So the ilium would be coming about here, so it'd be about 2 fingers from the spine, 2.5 fingers from the spine. Let's see what, there you go. Yeah, you look good. That looks pretty good, looks good. Let's see how you're doing over here. So what you want to do for this one is you're going to come here, find this, you're going to be about right there. So that would be your iliocostalis that would be causing shoulder pain. Okay. Yeah. Yeah. Okay. Yeah. So you're looking, so you can go up and down on it, go side to side. It should kind of feel kind of like a little rope there. She's finding some painful spots.
Yes.
Yeah. Okay, and let's look on the other side. And then all the way up attaches here to the mastoid process right there.
Yeah, I felt something up here.
Yeah, yeah,
when I did this.
Yeah, it goes all the way up and down, yeah. Okay, so we're gonna give it a good stretch. Let's go ahead and come on down, and then we're gonna come on up. So we're gonna go ahead, reach down, and reach up. Let's go ahead and bend our knees. Let's bend our knees and reach down and up and straighten. Reach down and up. Good. Okay. We did good. All right, so we covered all those muscles. Let's go ahead and we'll treat a few things on the treatment, take care of ourselves. So this self-care not only is good for us to learn how to take care of ourselves, but also for us to train our patients to take care of themselves, you know, and then also the greater public. Yeah. Okay, so let's look at somebody's.
Getting a lot of.
Right, that's it. Okay, so who can't pass the subscapularis test? Okay, and so all of us. So you didn't do too good on that one,
No,
right?
she didn't do
So
it.
once you go, we'll try it on you. You could leave the heat on around your neck again, because you like it, don't you?
Yeah.
Good. Is it still on?
Yes, I just turned it back on. I
Good.
guess it went off.
Okay, so we're gonna check her. So she when she did the subscapularis, lay on your back. So when she did the subscapularis test, she couldn't go the internal rotation here like that. She had difficulty with that. The rest of us there was a slight difficulty on the right arm and the slight difficulty maybe on the right
Not too
arm.
bad.
Somebody's right arms.
Yeah.
Okay, so let's take a look at this. So if we're treating somebody, we can check it really easy. And again, remember, we hardly use see. We hardly use any pressure when we're doing this. We're sort of observing where they are. We're not pushing them. Okay. So here, so we're going to go. So the subscapularis is what you want to do is go find the rib cage. Then you're going to go straight back. What do you think of that? It's okay. So we're going to go find the chest. Then you go straight back to the anterior part of the scapula, the front part of the shoulder blade. The anterior part. So the back of the shoulder blade muscle, the infraspinatus, causes pain in the front of the shoulder. And the underarm muscle right here causes pain in the back of the shoulder. So a muscle that's in the front causes it in the back, and a muscle in the back causes it in the front. What do you think of that?
It makes sense to a dyslexic.
Okay, now how's that? So what we want to do is, as we're treating her, we'll treat her a little bit on the stretch. Then we're going to see, does it make it easier to do the shortener? So we're just looking at that as we're going along. So we're going to keep treating, keep treating her until we can get the arm to pass the range of motion test. It was, you tolerated pretty good. didn't bother you too much.
No, it just feels pinchy, but it's not.
Not too
horrible.
bad, right? I'm just checking around to see what other muscles might be causing any trouble.
Seems like one of the key differences in the way you treat people compared to some other body workers who may not have myofascial trigger point knowledge is that you do this, that you like move them in their range of motion.
I keep trying to get them to pass all the range of motion tests. So
While
while
you treat
I'm
them.
treating you, I'm getting you to pass the range of motion test because that's how you get pain-free.
It's like you're testing it as you
The
go.
whole
like,
time.
oh, is this affecting
Mhm.
it? Is this affecting
Is
it?
this working? Is this making it a little bit better? And yeah, it is making it a little better. I can feel it. It's a little better.
Yeah.
So that's okay. So this even that much is
Like
good.
you're listening.
Just a
with
little
your
teeny bit
other
better
hand.
is good.
Mm-hmm.
Okay, so that's good. That's a good start. Let's just let it rest a moment. Let's take a look at the other side. So over here, we're going to take a look again, and it goes back pretty good, but it could go back a hair better, and then it doesn't want to go this way too good. So we're going to head again. So again, we're going to go feel the chest. We're going to go towards the scapula.
Mhm.
And straight in. And I'm using medium pressure,
Yeah,
and you're not bothered by it at all. Yeah. So in the arm, the shoulder, arm, elbow, and hand, there's 22 painful areas and 29 muscle groups we're going to be treating. 29 muscle groups and 22 painful areas we're going to be correcting.
Mm-hmm,
Amazing how, okay, here, so I can feel this muscle. See how it doesn't want to work right?
Mm-hmm.
Yeah. So I'm just trying to encourage it. I'm showing it. See, you can contract. I'm sort of showing it. I'm encouraging it. I'm inhibiting it from doing something it's not supposed to do. Mm-hmm. So it's going back a little teeny bit better. It's a little painful.
More pain. Yeah, that spot's more painful.
Okay, so then I showed you how to treat it a little bit.
Mm-hmm.
Now, did you think, did when you use the ball, did it get in?
Yeah, it definitely got in there.
Okay, so you feel like you could continue to treat
Mhm.
it. Good, 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 good. Super.
It feels like a pinchy
Yes.
nerve
Yes.
back here.
Okay. Excellent point. So what it's showing us, this spot is causing it to hurt in the back.
Yes.
Okay. So it's showing because see this underarm muscle makes it hurt in the back. So she's got that referred pain there. Yeah, we got it. So we recognize the pain. So here we're going to take it a little bit through its range of motion. Good. It's coming along.
And isn't this
Good.
also a form of muscle re-education, taking it
Totally.
through the form
Completely.
of range of motion?
Very much so. So we're re-educating it while we're treating it. That's right. That's correct. Re-education. Training it. Okay, so we got it to be a little bit better. That's good. That's good. Okay. Okay, so you keep treating it, and let's see what we can do in a couple of weeks. See how you do. Okay. All right. So let's have you go ahead and sit up, and then go ahead and come over this way, and then stand up. Okay, keep it down. Okay. So who else's subscapularis was? There was one side. Let's check it on you.
A little bit.
Okay, let's check it on you. So, okay, so let's check it when you're standing.
It was the right was worse than the left.
Good, that was the right. Yeah, I remember it was the right. Okay, and then here. So here, it doesn't want to go any more than there. Okay, okay, let's go ahead and let's have you lay down there.
Okay, can you bring the table down?
All right. All right. I'll have to find my table.
I need a
We'll leave it coming up.
boost up.
Okay, here it goes. Let's have you lay on your back. Okay, again. So we're going to take a look at the subscap again, and maybe if one of you could pull out my book and we'll look at picture of it. Okay, again. So we're going to find the chest. We're going to go straight back here. So we're going to go right to the back of the scapula. Oh, it says right there. You'll find it.
Subscapularis.
That's it. That's it.
Okay.
So easy to find
Coming
now.
up.
Okay. All right. So you see, here's the pain that it causes in the back of the shoulder that she was feeling. And guess what? It also causes pain all the way around the wrist. Isn't that crazy? But here's the muscle, and that's where we're going right down here with our hands straight down like this, and we're going in and like that. That's how we're doing it. Now if I put it off the stretch, you go in deeper, and that's what we're doing there.
Okie Girl OKC is asking, my hands have been falling asleep a lot. This should help, yes?
Oh yes, especially if we're treating the scalenes and the pecs. Okay, so especially treating the scalenes and the pecs, I think will probably do good. Also, the anterior coracobrachialis right here might help too. Where does she find that she has the numb? Where does she have the where does her hands fall asleep?
Let's see what she says. Pinky.
Oh, the pinky side. Yeah, then the scalenes would definitely be important for that. Yeah, the pinky side. Definitely.
Which one affects the elbow? I forgot.
Okay, that was the posterior superior serratus.
Okay.
Causes tip of the elbow.
And I have that. Okay.
And it can be so painful.
Yeah.
It's like like I said, it's like you could just touch, like just slightly touch your elbow, and you can scream, and then you treat it, and it's like nothing. Like you can't, it's nothing at all. So it's most incredible referred pain. Okay, so it's going down this way, good, down there. So it's doing it. So that's you're
better.
passing the range of motion
Halfway
test.
now,
Okay.
Yeah.
Okay, but now I'm going to add to it and do more range of motion tests. Okay, so I'm going to do all the stuff that the muscle's supposed to do. Okay, so I'm going through every fiber, and I'm getting every fiber to contract. Okay, and stretch, and contract, and stretch, and contract, and stretch. Good. Great. Super. Okay, you did it.
Okay.
Okay, so let's have you go ahead and turn to one side. Go ahead and sit up, and then sure. And then go ahead. You're going to do this kind of. Well, they sometimes used to call this the Egyptian. Okay, and so then also you come like this, and like that, and like this. Okay, same for you. So you go ahead. We're going to do this way, that way, this way. You're going to go like this, this, and then when you come this way, come out that way, come out this way, come out that way, this way, and that way. So we, can I have the referred pain chart? Okay, let's take a look at the posterior superior serratus here. So here it is again. Causes, let's see, oh, it's pain patterns in front here. Okay, so it causes it pretty much on the tip, but it could be that you might sometimes find it a little bit maybe towards the lateral, maybe sometimes a little bit towards the medial. But it, so you might find it in slightly other places, but it goes over here by the little finger also. So it gives us a pretty bad, and also goes, so it's a very bad pain causer in the back of the shoulder and the tip.
So it might be good for the person who called in with the hands falling asleep.
But they said that falling asleep in the baby finger.
Oh, but not pain.
Well, if it was pain, then it could be this one. Okay. All right. So this
This
again.
guy said his has been raw feeling lately, but he thought it was just from working too much.
Well, you know what? You can work hard and get, like, even if you're using your muscles too much, then you could do the trigger point, make the muscles in better shape, and then use other muscles.
Just
So
like do some self-care in order to counteract the
you could work.
overworking.
Yeah, you could work hard on yourself to be able to take a lot more. A lot more. You could keep working harder, and you could eventually get to where you could do a lot more use.
In terms of self-care. So,
Yeah, if you could use self-care, you could end up
it's a
doing.
matter of counteracting, like working hard or like doing a lot of exercise or whatever with
Like I've been doing this
actually
work.
doing self-care to counteract.
I think I've been doing trigger point work and massage, I think, since 1983, 84, until now, and I still pass all the range of motion tests. Like, say for instance, you're supposed to be able to pass all these range of motion tests. Like, you're supposed to be able to pass this test here, You're supposed to do like a right angle, okay? You're supposed to be able to pass this test. If you're going to be able to use your hands, all of us be able to play instruments, use the computer, we need to be able to do all these range of motion tests. We need to be able to deviate equally like this. We need to be able to deviate. We need to be able to spread the fingers need to be able to spread really easy. The thumb needs to be, you should be able to get the thumb to come behind the palm like this. Okay, that means your opponent's pollicis muscle is long enough. So we need to be able to pass all these range of motion tests. And it's essential. It's essential that we all have our hands. We need hands. Because what else are we going to do without hands? We got to have hands.
Yeah, so you were going to show us
Okay.
something on your
So
pain
yes, I was
chart.
going to say, so this is the protocol we did today, 45. Okay, so this is 45, and these are all the muscles we treated today. Okay, and the next one we're going to do is 46.